Being able to learn about dental health is extremely important, which is why Dr. Marsh is active on his blog to make sure people can learn how to take care of their teeth, even if they can't talk directly to a dentist. Spending some time with Dr. Stephen Marsh here in his office, and you can spend some time on his website, clevelandsmiles.com. Doctor, you have a blog you're very active with. Your most recent blog talks about gum contouring and porcelain veneers.
So that's a procedure that we do very often, and I like the blog to reflect those things that we're doing in our office.
Well, somebody that actually commented on one of your blogs in the comments, it's a review on you from Karen. Listen to this. Thank you, Dr. Marsh. I have to tell you, you brought back my confidence walking into your office, and in turn you brought back my smile. How about that? I've previously seen you on WKYC, and I'm proud to be a part of the remarkable smile makeovers. Well, her name is going to be actually featured, and her smile is going to be featured. So let's meet her.
Okay, my pleasure, Joe.
All right.
This is Karen, and when she first came in, you can see the teeth had moved a lot. She was actually a teacher, Joe. Never was comfortable smiling in front of her students. Had beautiful lip support, if you will. The lips are a frame. And I said, I think we can just do 4 porcelain veneers, do some gum contouring that you and I had just talked about, and give you a beautiful smile that you're proud of. And like so many of our patients, Joe, she said to me when we were done, I wish I had done this many years ago. I would have felt much more comfortable in front of the class.
Just four veneers on her.
4 veneers. We did some other reshaping. Yes, that's all it took in this case to do it.
That's incredible.
She was thrilled. And this is Stephanie. So Stephanie's teeth came in pretty nicely. She had had orthodontics as a young girl. The teeth had turned color. The gums weren't uniform the way she wanted. So we talked about it with her. We also did a wax prototype to give her something that was very predictable. We used this laser just to raise the tissue to make it uniform, and gave her 12 porcelain veneers, actually, Joe. She has, again, beautiful lip formation to give her that beautiful smile.
So that's both gum contouring, like you say, you remove the tissue and you move that, and then also the porcelain veneers.
Yes.
Incredible.
And the gum contouring is accomplished in our office with just a laser pen, and I literally can scribe on the tissue what I want the tissue to look like.
Sculpt it all over.
Sculpt it, and it's very predictable, and we like that. Patients like it as well.
Sure.
So this is Carrie. Carrie had a very, what we would call a gummy smile, and we talked about different options. She also wanted something that blended in pretty well. So again, we used the laser to raise the tissue so she didn't have that gummy smile. And like we did with in our first patient, we did 4 porcelain veneers, and on the bottom, Joe, we just reshaped them and did some whitening. So the combination of 4 veneers, gum contouring and whitening, gave her just a beautiful smile, I think.
Truthfully, now this last patient, I think, is one of the most dramatic, because it really shows that what we're born with doesn't necessarily mean what we have to be stuck with.
Well, I love the way you said that. And when Sheila came to me, she said, again, very friendly, but wasn't happy about her smile, and she said she actually hid her teeth when she would smile. She didn't want to show all that gum tissue. And the other thing that complicated her teeth was that she had worn them down. So a tooth in the front might be 8 or 10 or 11 millimeters. She had lost 2 or 3 millimeters, making them closer to 8. So in order to lengthen them, we did 2 things. We raised the tissue, and again, using the laser to make that predictable. And then we used porcelain veneers. We did 8 porcelain veneers. We also lengthened them, we call it incisally, where you see them, and that gave her a tooth that was about 11 millimeters. That's a little technical, Joe, but in the end, it gave her a smile that she said she loved, and she came home to her family and husband and said, oh my God, I love it. Again, I wish we had done that years and years ago.
Well, doctor, there's nothing technical about the before and about the after. It's truly remarkable. It really is. Now, if you want to find out what Dr. Marsh and his team can do for you, no matter what techniques he has available or how technical it could be, he'll keep that to himself and his team, I promise. No big words between us, okay?
Absolutely, Joe.
Simply call 440-461-1003 or log on to the website. We talked about it already, clevelandsmiles.com.
This segment of Good Company was sponsored by Dr. Steve Marsh and Cleveland Smiles.